Hello, and welcome back to Authentically Shawna. I'm your host, Dr. Shawna Burke. Today, I am joined by a doctor of naturopathic medicine, Dr. Laurel Kwon. Dr. Laurel has been my personal naturopathic doctor at Cone Health Institute. And one of the techniques that I have done with her, I would say in the longest duration, is using a therapy called ozone therapy. Welcome to the show.
Thank you so much. It's so great to be here.
So tell us, what is a naturopathic doctor?
Yeah, it's such a small profession that I feel like some people aren't that familiar with it. But a naturopathic doctor is a primary care provider that is trained in conventional health sciences, but specializes in natural healing techniques. There's lots of different tenets of naturopathic medicine, but I think probably the most important is root cause medicine. Naturopaths try to be more focused on identifying and treating the root cause rather than just treating symptoms or suppressing symptoms. And then using a wide variety of natural therapies like nutrition and lifestyle management, but also herbal medicine, homeopathy, ozone therapy, detoxification, and then sometimes medication, so hormone replacement or different medications as needed.
Let's dive into ozone because I think for both of us, it's one of our favorite techniques.
100%. Ozone is my favorite thing ever.
You've taught me so much about it. Thank you. And so that's why we're sitting here, is because I think it's probably the best kept secret. Like, not very many people know about it, and it's so powerful.
Yeah,
And I think almost everyone could benefit from it. That's something that we've had a conversation, is the great thing about ozone is that it benefits so many people. It has so few side effects. Is
correct.
such a counterpoint. It doesn't happen very often
It's
in
rare.
the healing world,
Yeah.
or like in any world really, where you have something that has so much benefit and so little.
Downside?
Yeah.
Yeah,
Okay, so
for sure.
what actually is ozone?
Yeah. I had heard about ozone over the years, a little bit in school, but I wasn't trained in ozone in school. And when I got into practice, one of the offices that I worked at used ozone therapy. And every person that I saw getting treated with ozone saw an improvement, no matter who they were, what they were treating. That was the one therapy that I saw firsthand helped every single person that walks the door, and I'm like, "Wow, I have to learn more about this." And I went and got trained in ozone therapy from Dr. Frank Schallenberger, who's kind of the father of ozone therapy in the US. He brought it over from it's very popular in places like Germany, European countries. But anyway, back to your question. Ozone is a highly active form of oxygen. Instead of having 2 oxygen molecules, it has 3, and that extra oxygen molecule makes it highly powerful at fighting infection, boosting immune system, and just helping the body heal.
And it sounds, we've probably all heard of ozone in like seventh grade science class. Like, oh, how do you create ozone?
Sure. Ozone is made in the office by taking medical grade oxygen and putting it through a specialized generator that turns that O2 into O3. And then that gas can be safely administered in controlled doses in a wide variety of different ways to treat whatever we're trying to achieve.
Let's talk about what it does in the body.
Before I get into that, the important thing to note is that it's really helping with oxygen utilization at the cellular site, meaning it's helping the mitochondria. All of our cells contain something called a mitochondria, which is like the engines in all of our cells. And mitochondria takes oxygen and glucose, blood sugar, and converts it into energy, cellular energy. And then that cell has energy to do whatever that particular cell does. And ozone stimulates that mitochondria stronger than regular oxygen, upregulating cellular energy with and to help the body heal and live. Oxygen is vital for life, right? So,
Without involving your gastrointestinal system, which I think is an important note, because I think so much of what we do
yeah.
when we think of holistic things, it's using our gastrointestinal system. And this is a way to subvert that system and to continue to push more oxygen
Yeah,
into
because
the
it's not
system.
like a herb or a nutrient that you have to process and digest. It's something that's already innately in our body. So we're just giving the body more of what it needs. And it's our number one nutrient. You can live a month without food and a week without water, but you can only live about 5 or 6 minutes without oxygen. So we're just giving the body its most vital component at a high, powerful level.
And let's talk about when you use ozone in your practice. Let's talk about like acute injury, like a virus or bacterial infection. How does ozone play a role in the healing process?
Sure. Basically, anybody can benefit from ozone therapy because, like we're talking about it, it's vital for life, needs oxygen and needs more of it. Your need for oxygen increases when you're sick, and that could be like an acute illness, like a cold, or that could be a chronic illness, or even any kind of chronic disease process requires more oxygen. For example, a bacterial infection, a viral infection. Our white blood cells actually make ozone when we're fighting infection, so that the oxygen supply is consumed more during an illness, during an infection. We're just giving that body back what it needs to for that immune system to work at its best.
Yeah, it's helping you heal yourself at a more expedited rate. So, like in my household, I now have an ozone generator,
I
thanks to you,
love
Laurel. And
it.
so, when someone has a cold or a flu, it's like as soon as someone has a first sneeze, I'm like, we're doing ozone
Right.
because it, I just have, in my own personal experience, I've just seen it kick it so fast. High dose oxygen just, it changes a cold that could last a week to a day or two.
You're flooding the lungs or the sinus cavity with so much oxygen that's detoxing, and it's like a magnet for infection.
Someone said to me that ozone helps you get rid of whatever isn't you.
Yeah, I like that.
It's
It's a good way to look at it.
yeah,
Yeah.
it's helping your system recognize, okay, this is not me, this is a pathogen.
Yeah,
Let's clear it out of the body.
for sure.
Let's talk about the ways in which you use ozone. You can use it in lots of places in the body,
Yeah,
which is lovely.
another great benefit of ozone is it can be administered so many different ways depending on what you're trying to treat or maybe the person's age or wide variety of reasons. Like we were mentioning earlier, it can be used through sinus insufflation and ear insufflation. So you can use it for like a cold or a sinus infection or ear infection or allergies. It can be used vaginally for UTIs or yeast infections. It can be used rectally for to help the liver, to help the gut. We have an ozone sauna that's really great for detox and sleep and metabolism, and then can be used intravenously. More systemic effects is really great for that too. We also have topical ozone, ozone supplements. I mean, the list goes on and on. Some people ozonate their water, ozonate olive oil, so it can be used many different ways depending on what the goal is.
Let's talk about some of the reasons people come to see you outside of acute illness for ozone therapies.
Infection is the most common thing, acute illness, chronic illness. Again, I feel like a broken record, but everything can benefit from more oxygen. Pain is a really common one. Pain is the result of lack of circulation to an area. When you don't have good circulation for whatever reason, it could be an injury or it could be an autoimmune thing. When you don't have circulation to an area, to a part of the body, and you don't have that blood flow of those nutrients to get there, then the pain increases. So, oxygen and ozone therapy helps restore that circulation, restore that oxygen to help pain heal. So, that could be localized pain that can be injected into, that could be systemic pain that can be helped with IV therapy. That's one that sometimes people don't think of right off the bat for ozone is helping reduce pain in the body.
Let's talk about the sauna because that's the component that we worked together with a lot. And let's talk about who could benefit and what are some of the main benefits of the sauna version because it's different, has, we'll say, enhanced benefits from just doing a quote unquote regular sauna session.
Yes, it is different than a regular sauna session. The ozone sauna is a hard shell clamshell sauna that you sit in with your head out because you don't want to breathe in tons of ozone. So you keep your head out of the sauna. It's a steam sauna, and that moistens your skin, brings blood flow to your skin, moves your lymphatic system. And then we pump that pod full of ozone and you absorb ozone into your blood circulation. And it's great for detox. Like we were saying, it's a magnet for different bugs and different toxins. So you sweat out heavy metals and bugs and things like that. It stimulates your metabolism, so it's good for weight loss. It's good for your skin. A lot of people have noticed a huge improvement in sleep with ozone sauna. I got the ozone sauna specifically because I loved I love IV therapy with ozone, but not everybody is a candidate for that. Not everybody wants to do an IV. Plus, an IV usually takes around an hour, and you have to have good enough veins to get an IV therapy. Sauna is a 25-minute treatment. Most people tolerate it really well because it's steam sauna. The temperature is lower than like a dry sauna because that humidity makes it more intense. And having your head out of it makes it a lot more tolerable. You can speak from
Yeah.
experience. It's definitely you can do it. You can handle 25 minutes of that sauna, but it's a great therapy. I love it. It really boosts the circulation of oxygen all throughout the body.
And for me, the reason why we were doing it is because we kept trying to get my body to detox and it just wasn't. It was like, please stop.
Stuck. Yeah.
It's like we can no longer take
Yeah.
things through the oral route. Like we gotta cut this. We gotta figure out another way to help my body process.
For sure.
And that's what was so lovely about using the ozone sauna was I felt like I could process without having to involve this my system that wasn't operating
Yeah.
ideally.
Yeah, because it helps that oxygen utilization. It helps that cellular energy. This is kind of a funny side note, but the company that makes the ozone sauna, Longevity, they're a company that I really trust for ozone generators, and they were seeing such amazing results from the ozone sauna at helping people, and from more in the athletic world, right? Helping people improve their times, improve their speeds, that they actually were contacted from people that had camels that they would race, and they were wondering if the company could make a sauna that camels could sit in and get ozone sauna because that would improve their racing. Unfortunately, they weren't able to do that. I just thought that was so interesting, not only because I had the picture of a camel inside of a sauna, but
Right.
also because with animals, there's no placebo, right? If
Right.
if we see an improvement with animals, we know that it's working. Oh, I just thought that was really cool.
Darn that they couldn't make a
Yeah, I know, it's
camel-sized
a
sauna.
bummer.
I love it. So what are let's say you don't what are some of the best ways to use ozone as a preventative measure?
Probably nasal. I would say people come in and get nasal ozone quite often in our office, even if they don't feel bad, or maybe they have maybe the air is not the greatest that day and they just want to stay healthy, or they have some allergies. That would probably be what I'd recommend. I do have some people that come in like quarterly for IVs too, just they want to stay healthy. So it just kind of depends on the patient, but any way that you can get ozone in is beneficial.
Let's talk about the IV portion. How does that work?
Sure. So ozone's a gas. So the way that it works with IV is that first the person gets some hydration, and then we take that same bag and just put it below the heart. And using gravity, I collect about 8 ounces of blood, small amount of blood, and then I ozonate that blood. So I add some oxygen to it, and then we just put that back, hang that bag back up, and you get the blood back. And the whole process takes about an hour. It's not a whole lot of blood, but again, what it's doing is stimulating systemically all the mitochondria throughout the body to improve oxygen utilization.
What are some things that slow down people's mitochondrial function?
You name it.
Life, living.
Yeah. Yeah. Of course, there's lots of things that contribute to aging and illness and disease, right? That's a whole long list. That's the same for mitochondria. And mitochondria health is really the cornerstone of health just overall, right? If we could fix one thing in the body, your mitochondria would be the most important thing and the thing that you would see the most difference. So if we had to improve mitochondrial function, you would see everything improve. Unfortunately, testing mitochondrial health can get really expensive, like testing different enzymes that correspond to the mitochondria. So it's not tested as much mainstream, like as like a general blood test. But there are people that do it, and by there's different machines that can check how much oxygen you breathe in compared to how much CO2 you breathe out while doing a controlled exercise. And that is a great way to test your mitochondrial health because that's really is telling you where you are aging, health wise. So basically, anything that causes disease causes mitochondrial dysfunction.
Which is so important
100%.
because if you can figure out how to ways to optimize that,
Yeah,
which ozone is such a great tool for that because
sure.
it's I'm gonna call it quote unquote easy. It does not require that much time.
Right.
It does not require
It's safe.
it's safe.
Yeah.
It doesn't require like you to have a bunch of downtime afterwards.
You're not
So
taking 15 supplements.
right.
Yeah,
Right.
it's great.
That's why we're big fans.
Yes. Huge fans.
What are the side effects of ozone?
We're just replacing what's naturally in the body, just giving the body more oxygen. So the side effects are really low. If it's used safely, it's one of the safest therapies out there. Because we are turning cellular energy back on, that means that we're also turning detox back on. So some people, a very small percentage of people, might notice some like quote unquote detox reactions, which could be a headache or a little bit of fatigue, but that's short lived.
This is, I think, a hard question to answer. So good luck.
I love it. Okay.
How much of our time is ideally are we spent detoxing versus adding in nutrients? Because I think that's where a lot of this uh buffering happens in our system, right? Is like how are we getting rid of the stuff that's not serving our bodies, but then how do we continually add in? And I think it's like this up and down of like add, let it go, add, let it go, add, let it go. Have
Sure.
you figured out a formula or what works best in your
Well,
practice?
our bodies are detoxing every minute of every day our entire life. Detox has become a buzzword, especially in the natural health space, where people want to detox their systems, and meaning that they want to ramp up the excretion of toxins and bugs and parasites and all these different things, which is great. But you have to have the energy to be able to tolerate that. You have to meet people where they are. People have to have enough energy on board. They have to be able to handle the big dump of all of those toxins.
The hard part, I'm only saying this because I've been on this end of it so many times. It's exactly what you're saying. I know that my system is overloaded, but I don't have the energy to let go of the toxins. That's why we were working together in the ozone space, was because I just didn't have enough energy to release toxins, and there wasn't any more things I can put in my body that were helping. Ozone will give me some bandwidth to help me release something, because otherwise I just don't have the energy to release.
That's the great thing about ozone is that it is a foundational nutrient. We're not giving you like a powerful medication or herb that's pushing you too hard. The other thing is that the dose of ozone can be manipulated. When I'm doing ozone with people, it's usually done in a series of treatments. And usually throughout that series, we're slowly ramping up the dose as that patient tolerates it. We don't start with the strongest, most powerful thing because that might be a little bit too much. We slowly ramp it up. And then I have people that come in and have done ozone for years and then they're used to it. Then for them, I can start stronger. But again, I'm meeting people where they are.
When we were doing the sauna, we were changing the temperature as well. Not only was I getting more ozone, but we were increasing the
Yep.
temperature every time to help my body purge even more.
Right. You're getting more blood flow, sweating out more things, in addition to having more minutes within that session of ozone therapy.
And that's when we started to see some great results.
Yeah.
And the gross part about ozone is that you can see what's coming out of you
Yeah.
because you
You're,
have a white towel and
you're
you're like,
sweating it out.
oh, wow,
Yeah. Better out than in.
that's nasty. So fun. It's
So
like,
fun.
oh, look, I did it. Look at the towel. It's gross.
Yeah, but people walk out of there and feel great.
Feels so much better.
Sweaty, but
Yes,
great.
sweaty but great. You've really let go of a lot of
Yeah,
gunk, and you get to see the proof of it on your towel.
absolutely.
Let's talk about other modalities that
Sure.
you commonly use in your clinic that are in the naturopathic wheelhouse.
Yeah, so my favorite, not really modality, but my favorite thing to do with people is especially lab testing. I do all kinds of lab testing, but most people have done the general blood work and general testings with their doctor. And I like that too because as a naturopath, I'm real picky about labs. So even if everything is quote unquote normal, I want to make sure everything's also optimal. But outside of general labs, I love different kinds of specialty labs. My absolute favorite is food sensitivity testing because it's one of those things that you really don't know until you have tested. There are different types of food allergens. There are immediate allergens that create an instant response. You eat that food, you instantly have some sort of reaction. You know what that is for the most part. I don't really test for that, but there's another set of food allergies or food sensitivities that have a delayed onset, but takes 3 to 4 days to create that immune response, to create that antibody. And that's when you start noticing inflammation in whatever way it might be for that person. But for example, you have an almond and then 4 days later you have a headache. You would never put that together. The blood test, I draw the blood in office and it checks for 96 of the most common food sensitivities, including candida. And then based on those results, I put people through a detox off of those foods. That could be short term, that could be long term. It depends on what results come back. But that is a fabulous test that I think absolutely everyone should do. I do it on all ages. I poke fingers for little kiddos, but I think everyone can benefit from it. And it's a very personalized detox, diet detox for people.
Let's talk about what happens when you see what you're sensitive to. So let's say someone's sensitive to cucumbers.
Sure.
What do you do with a sensitivity?
It takes roughly 3 to 4 weeks for the antibody to come down. The lab will rank the antibody on a scale of 0 to 4, and just to give me an idea of how bad that current antibody is. But it
Let's
takes
say let's tell people what an antibody is.
sure, meaning that when you eat that food, your body is generating an immune response to that food, to that particle. So almost like your body's thinking that you have a flu virus, but really it's just a cucumber in your bloodstream. So you have to say, for example, cucumber, you'd have to avoid all cucumber. So cucumber and everything that contains cucumber, which sometimes there's things that you don't think about. And if you do that, then your antibody in your blood will come down after a few weeks. After that time, we can decide if you're missing that food, if you want to try it. If you've been really good about avoiding it for the last month and you have a little bit of it, you're going to have an instant response if it's a problem. Because now theoretically your antibodies are zero. So if you have something, it's going to be a big jump back into that swing into an immune response. And then we would know if you had some kind of response that that's a true allergy and you would need either more time away from it, maybe long-term time away from it. With those, I've done so many of these tests and I've seen all different test results. I've seen completely zeros across the board, which is great. And I've seen every food
That's me.
that's come back positive. And that doesn't mean that you're allergic to every food. That just means that there's some gut inflammation or leaky gut. So those lucky patients have to do a little bit more of an in-depth, intense detox and basically eat everything that they don't normally eat, completely change their diet for a period of time so that so the immune system can reboot, so to say, while also healing the gut, supporting inflammation within the body.
And I would say if you've tried every quote unquote diet, like you're eating clean, you're eating keto, like and
Right.
you're still not feeling well, I would so recommend this test because
Yes.
it's like
There's
nearly
no way to
impossible to figure it
know.
out.
Yeah.
And for me, so like that's what I'm saying. Like I was this patient, like I had so much gut inflammation
Yeah.
from candida that it didn't matter what I ate. My body was quote unquote allergic to all foods, which is
Right.
really fun because I did the candida diet. I was eating super clean
Yeah.
and nothing was helping.
Right.
And it was like, I'm doing all the things. How is nothing helping?
Right, and obviously we have to eat every day, and if we're
Right.
eating food that's causing chronic inflammation and really messing with our immune system, it's so hard to combat that with other modalities. If your diet is making you sick, we gotta start there.
And I think it like the quote unquote narrative that's going around is like, oh, just eat organic, just eat clean,
Right. Which is good
which is
too.
good too.
Yeah,
But if you're having this constant gut inflammation and you don't know what's going on,
right.
this is such a great way to look at it that not many people know about because it's not a test that's offered
Yeah.
widely.
It's not widely available, but it's super helpful, and yeah, I think everyone should do it.
We also wanted to talk about liver cleanses.
Yeah.
Let's talk about our liver. I know it has like a quadrillion functions, and let's talk about how our livers get like slow and sluggish
Yeah.
and what we can do to help our livers.
Liver inflammation, liver stagnation usually presents in ways that you wouldn't expect. It doesn't always come up as a liver thing on a blood test, for example, because that's usually when it's a little bit more advanced. But you can have a slow, stagnant liver before you get into overt liver inflammation, meaning that let's say I have women come in that have a lot of hormonal issues, trouble with their periods, trouble with PMS, things like that. And instead of treating the hormones, we can really treat the liver, support the liver, and hormones start to balance out because the liver has just been overrun by toxins in our food, water, air. We don't have the necessary nutrients. Maybe our genetics are not turned on, but there isn't like a go-to liver cleanse for everybody. I wish that was the case because it just depends on that person and what nutrient they're missing or what maybe they're consuming something that they don't realize is hard on their liver. Fatty liver is way more common than people realize because insulin resistance and prediabetes are just rampant right now. And that just causes a lot of fat to accumulate in the liver and makes it hard. And then you're not able to process your cholesterol, you're not able to process your blood sugar. And that causes a lot more chronic diseases that we can avoid if we just support the liver through supporting blood sugar. There's lots of different ways to go about it, but it's our filter. It's how we cleanse through everything that we're eating, drinking, and doing. And it's our first pass, meaning that everything that we consume are all of our food, medication, supplements, all run through our liver before they reach our bloodstream. So it's our way of that our body protects us. We need to support that organ so that we can continue to be as healthy as possible.
What are some classic symptoms that you're having liver stagnation or fatty liver?
That's a good question. I mean, there's so many different symptoms, but people usually will come to me and they have gone to their conventional doc and they've been told that they have high cholesterol and they're pre-diabetic and they need to go on these different medications. But really what they need to do is support and cleanse their liver, and a lot of those things will improve. But I guess symptom wise, I see things like fatigue, sluggishness, feeling swollen. Autoimmunity is a huge thing with liver health. We're seeing tons of autoimmune stuff, hormonal issues, infertility. I mean, really everything. I hate to say that,
Comes
but
back
the
to
liver
liver.
is such an important organ.
I will say personally, I was having a difficult time before my periods. I was feeling like I could light a match to the world and have no remorse. My liver stagnation was making me feel so out of sorts.
Absolutely.
And
Yeah.
I feel like once we really started to address that, I started to feel less like burning everything down because I just felt so horrendous.
Yeah.
And what you had said to me, which made so much sense, was like, it's not your hormones that are the problem, it's your liver
Yeah.
that's causing your secondary response, which is your hormonal response, to be so out of sorts. And I
Right.
was feeling bonkers.
Yeah. Yeah.
And it was like, this has never been me before. I don't know why I feel so horrendous once we really started to help my liver process, which again, we were using ozone, we were using a bunch of
Sure.
strategies and techniques, but it was really getting that liver stagnation down that helped a lot.
Yeah. Yeah. And metabolism is so important to support the liver when people are trying to maintain a healthy weight.
I wanted to ask about hormones in a different context because
Yeah,
I know hormones play a huge role in our as females in our lives through the lifespan.
absolutely.
I feel like you see the whole lifespan in
I
your
do.
practice, which is awesome.
It's so fun.
And so, what are some things that you can do to optimize your hormones? Let's talk about like through the lifespan,
Sure. Okay.
because I think again one of our like common narratives is like you're just gonna feel bad.
Yeah.
Good luck.
It doesn't have to be that
It doesn't
way.
have to be that way.
Yeah, for sure.
I think we both know like that there's so many options, but that's not the common narrative.
Women deal with hormonal imbalances throughout each decade of life, and that presents obviously as different symptoms. It's all comes back to hormones. So if we can talk through the decades, I guess usually when I have younger women come in, even like in their teenage years, 20s, things like that, usually they're coming in because of skin health. See a lot of like young girls coming in for acne. That's not always a hormonal issue, but oftentimes there is a hormonal component, and the standard of care is to provide maybe birth control or antibiotics or Accutane. So commonly I see teenagers on one of those three medications if they have acne, and there are other options. And moreover, I feel like people don't realize that some of these things have long-lasting effects, and before turning to those, we can try a couple other things. Along with that, I see that teenage girls in their 20s are oftentimes protein deficient, sleep deprived, overcaffeinated, stressed, right? Dehydrated, and all of these things disrupt our hormones. Of course, there are hormone disruptors in our environment as well, more than there used to be in the past, right? We're just bombarded with plastics and different toxins and commercial meats and foods and things that have lots of, or perfume. I mean, you name it. There's lots of different toxins that are messing with our hormones and making it harder than it used to be. Filling in the basics helps a lot with hormones for those kinds of things. As we roll into like these and we see periods start to change, irregular periods, heavy periods, which sometimes can contribute to anemia, hair loss, fatigue, infertility, those kinds of things, different things we can do to support that. And then getting into the 40s, we see like perimenopausal symptoms. Average age of menopause is around 51. So see different things happening there. And there's lots of ways to support that, which all comes back to supporting the adrenal health and managing stress.
Let's talk about what the adrenals are
Yeah.
and how to optimize that because I think all of us have a problem.
Yeah, adrenal fatigue is real. There's a lot of people with adrenal fatigue, unfortunately. The adrenal gland is a little tiny gland that sits above the kidney and it secretes various hormones like adrenaline and cortisol and DHEA. We'd like to think of it as our backup ovary, meaning that as women transition into menopause and the ovary kind of goes to sleep and stops ovulating, the adrenal gland is supposed to kick in and kind of pick up the slack and give you a little bit of hormone because DHEA is the building block to estrogen and testosterone. If you have a healthy, strong adrenal gland, your transition through menopause is going to be a lot easier than if you don't. But unfortunately, adrenal fatigue is super, super common. And you don't always know that you have it or don't have it. But the problem is that women are burning the candle from both ends and they usually put themselves last, unfortunately. So their body is tired but they mentally are pushing through the day-to-day stuff just to get things done and slowly starving their adrenal health, which just means that when you hit that menopausal hurdle, it's just a lot harder.
Because you've already emptied your stores.
Correct. Yeah.
Like, your adrenals are supposed to support you your whole life, and you've
Yeah.
now burned through it in half your lifetime.
Correct.
Yeah.
Yeah. Unfortunately.
Yeah. But the good thing is that it's changeable.
Absolutely.
It's turnaroundable.
Yes.
You just gotta know that it's a thing so that you can turn it around.
Yes. Most powerful tool for the adrenal gland is really lifestyle changes. And they don't have to be huge lifestyle changes, but little things make big changes as far as like limiting caffeine, being boring with your routine, meaning like trying to go to bed at the same time, wake up at the same time, monitoring when you getting sunlight first thing in the morning and not having lots of light before bed. And all these little tricks and tips help your adrenal gland be stronger so that when you are actually stressed or when your ovaries are quieting down, then you have that gas in the tank to get you through.
Which I think, like, our bodies are meant to handle stress. Like,
For sure.
that we are built to be resilient, and we've just, like, pressed that button too many times.
Right. Right.
Just our world requires us to be resilient so much that you have to figure out a way to build back up the reserves.
Yeah, and it's all about what you're doing most of the time.
Right.
This is not like you don't have to be perfect all the time, but what is your lifestyle like most of the time? What are you eating most of the time? How much are you exercising? All these little things. I know it's so boring, but it's impactful.
And then what happens as people are transitioning fully into menopause?
Yeah, so fully into menopause, I see that a lot too. Sometimes that just means supporting women through that transition and supporting hormones. Some women choose hormone replacement. That's obviously an option. Not everybody wants to do that, and that's fine too. But I think I'm very pro bioidentical hormones. I think they're a great thing, not just to help symptoms, but also from a preventative medicine standpoint, meaning it can help with bone density and cardiovascular health and helping preserve your brain health. There's lots of benefits there.
What does that look like to start that process? When do people start that process? What does it look like to work with you through that process?
Yeah, usually I'm initiating hormone replacement after someone's period has stopped. Not always. I mean, sometimes it's when they still are having a period where we're introducing hormones, but usually it's after the period has stopped. We can use things like herbs and nutrition kind of more through that transition of perimenopause. And then as the period starts to go away, and it doesn't always happen that way. Sometimes I have people that come in that have had a hysterectomy or other things that have stopped their period. But it just kind of depends. You're going to hear me say that a lot
I
because
know it's so hard.
Naturopathic medicine is all about treating the individual, and it just varies depending on that specific person. But yeah, I guess to answer your question, hormones are usually started once a woman has stopped their period, and then we slowly add back a little bit of hormone to help with symptoms and longevity and those sorts of things.
And your favorite way to do that is orally, skin.
Yeah, so with estrogen, I prefer through the skin, so transdermal, which could be a cream, it could be a patch. Progesterone, so if you're taking estrogen and you have a uterus, you need to be also taking progesterone. That can be given as orally, as an oral pill, which can also help sleep. It can also be used as a cream as well. So that's usually how those are done. But estrogen is best done through the skin. And I always prefer a bioidentical, so meaning that we want to replace hormones that are the same as the hormones that your body makes. We don't want to give synthetic hormones. That is where a lot of the bad publicity came out of when we talk about hormone replacement is those hormones that were studied at that time were were synthetic hormones, and women didn't respond as well to those. The other big piece of that is the age at which hormones are initiated. The recommendation is to start hormone replacement within 10 years of your last period. Doesn't mean you can't after 10 years, there's still things you can do, but your body starts to change after you haven't had any hormone in your or very low hormone in your system for 10 years. So to just turn it back on again takes a little bit of finesse. If women want to try hormones, start it sooner than later.
And then let's talk about like 60s, 70s. What are some common things that people come see you for that can be optimized health-wise?
Yeah, I mean, I do work with hormones in those age brackets as well, but when we start to get into like a little bit older, usually people are coming to me on medication, whether that means that they want to just discuss the medication that they're on, see if they're on the right things, see if anything's interacting with each other. Um, or maybe they need to be on something and they don't realize it because there's also a big group of people that hate the doctor, avoid the doctor, but I'm, I guess, a little less scary, so they'll come see me. And it's like, well, maybe you should be on some medication because we want to keep you healthy and prevent any kind of event as well. Not that medication is my first choice, but sometimes it is necessary for people. It's managing those kinds of things. What do you need? What's the least invasive thing that we can do to still keep you healthy and prevent any kind of major event? That's the goal there.
And I know bone density and bone loss is a big hot topic as
Yeah.
people are aging.
Mhm.
And I know so much of that is attributed to a shift in hormones.
Sure.
What are things that people can do to help with that besides bioidentical
Yeah, so
replacement?
estrogen definitely helps bone density, but it's not the only thing. Bone density, a big part of why bone density has changed more in the modern day is related to acid base balance, meaning that we just tend to be more acidic than we used to be. And when our body wants to keep our blood at a very specific pH, if our blood is more acidic because we're having more alcohol or drinking more caffeine or stress is another huge one that drives more acidic blood, our body is going to take minerals from our bone to alkalize our blood and keep that pH exactly where it needs to be. So the body will always prefer that blood pH being ideal over bone density. If we can keep the acid base balance ideal within the body through diet, managing stress, that can help a lot. And then, of course, weight bearing. Doing more weight bearing activity, walking with a weighted vest is like very popular right now, but or doing weights. I think that muscle mass and strength training is really the key to longevity. It's so, so important.
And I think it's so funny because the majority of our ancestors were farmers.
Yeah,
And so they were doing weight bearing exercise
great.
until they died.
Yeah,
So you maintained a farm. And so that was already built into your daily life.
yeah,
So now it's us in this more modern era trying to bring that into our world and realm because that's what our ancestors did. And that's how our body has adapted to life on planet Earth.
yeah, yeah. I was reading the other day about how certain countries have communities with that are in that higher generation, over 90, over 100 years old, and it's not necessarily because they're exercising more, it's just their actual lifestyle is more active. This their day-to-day activity is higher, and that's just what they continue to maintain, and that's what keeps them going.
Which, yeah, we're trying to figure out the modern replacement for that,
Right, right.
what our modernity looks like as
Yeah.
we take a step back from doing things quite so manually as
Yeah.
other generations have.
Right.
I also wanted to ask you because I know you see trends, like that's I think the cool part about being a clinician is you get to see trends as they're coming and going. What's the current and what are people coming in to see you for at the moment?
Current trend, I mean, people are always very interested to find if there's any unwanted bug in their system. So
Interesting.
that's very popular. People wanna know if they have any bacteria, viruses, parasite, fungus, candida. We're always looking for those little guys because they are very common and, a lot of times missed and not taken care of, which can contribute to other problems and other symptoms. But there's lots of ways to test for bugs, depending on what we're looking for. My office uses applied kinesiology or muscle testing as well to do a quick check for bugs. That's a kind of unique thing that's done at the Cone Health Institute. Sometimes we check on lab work too. That could be things like stool testing, blood testing, hair samples, urine tests. But I would say that that is a very common thing that people are interested in knowing and wanting to know how they can best treat without over detoxing, like we were talking earlier.
Absolutely.
Yeah.
And I think also there's this interesting concept where it's like, I need to have everything out of my system.
Mm,
And that's also not healthful. Like our body ideally has some of these pathogens
yeah,
that work symbiotically with our systems.
sure.
And so it's figuring out what's too much and how to
Yeah,
get back into that equilibrium.
it kinda goes back to the germ versus terrain theory. Is it the bug or is it just the terrain that your body is letting bugs grow more easy, right? If someone has strep throat and they're around 10 people, not everyone's gonna get strep throat. The people that have a weaker terrain or a weaker immune system are gonna catch it more than someone that has a strong, vital immune system. We talk about, the fishbowl idea, meaning that when a fish is sick, we don't treat the fish, we clean their tank. We have to work on that terrain and just be as healthy as we can, getting in lots of nutrition, and reducing our environmental exposure as much as possible. So it's for sure not always the bug. And some bugs we need. Our probiotics are very important for our digestive system. We have like 3 to 5 pounds of probiotics in our gut that are very important for maintaining our immune system, digesting our food, getting nutrients from our food. Bugs are not always bad, but sometimes when they're left to grow like crazy and we don't know about them, they can be bad. So
Right. Unchecked.
unchecked, yeah. Or like places that you don't always think, like for example, the teeth, right? There's so many bugs and bacteria and things that can live in the teeth and that we don't not always have symptoms of. Not to go down rabbit holes, but things like root canals can allow all these microtubules of bugs to exist in our bodies that can contribute to other problems.
It's so fascinating because we live in like the antiseptic age. We kill so many pathogens,
Right,
but then we probably have like the least healthy society that's ever existed. And so it's like, how do we keep the good pathogens that are working together with us
for
that
sure.
are not bothering us? Like I took microbiology, which I'm like, please don't take that. Like
Yeah.
if you're listening, please don't take that. You probably won't sleep. Like I didn't sleep for the summer because I was really stressed. I was like, oh my gosh, I didn't know that all these pathogens existed. And we had to go around our house and swab a surface.
Mm.
And I swabbed the doorknob, like entering the house, and it grew this really beautiful bacteria on a plate.
I love that you called it beautiful.
It was really pretty. Like it was really cute, really hot pink,
Gorgeous bugs.
gorgeous bugs. And I was like, well, I haven't died yet. I use my doorknob every day. I,
Right.
I do wash my hands,
Yeah.
but like there are pathogens everywhere
Right.
and we're okay.
Yeah.
But wow, that was a rough summer because I was like, there are so many bugs.
I'm covered in
I'm
bugs.
covered in things all over.
Yeah,
But I think that's help. Like they're working with our system, and not everything is pathogenic. And so, how do we get back to balance?
sure.
Which I think is the goal of naturopathic medicine: is
Yeah,
getting yourself back into your natural balance.
yeah.
You could tell people it is the one thing, if you don't know where to start, if you're like, I don't know what to start doing, I'm overwhelmed with health, like where's a great entry point into your health?
What do you mean? Like what?
Like would it be to optimize your sleep? Would it be to drink clean water? Would it be to figure out what your main stressors are in life? Like what's the thing that you're like, if you could just look at this one thing a little differently, your world will start to shift.
Yeah. Well, this is such a small thing, but our world, well, at least our country, is chronically dehydrated. It's like the number one reason that people walk into an emergency room is dehydration. They get some fluids, and whatever crazy emergency that they were having improves. So, if we could all just consume more water and not just plain water, but maybe adding some electrolytes and minerals to our water. We need more water for sure. Every day I see people that are not consuming enough water. Sleep is another huge one. People need to prioritize sleep for sure, and get better sleep hygiene, right? We're all like up late on our phones with that blue light and we're not getting enough sleep or our sleep is like not consistent. Sometimes we have great sleep, sometimes we sleep an hour. Sleep is how we heal. It's how we grow when we're young, and it's how we repair. That's when we make our hormones. That's when we repair all of our systems. So if we're not sleeping, we're not healing, period. And then trying to reduce controlling the controllables. So trying to reduce as much environmental toxicity as possible, which is small things, drinking filter water, trying to eat organic, I'm trying to reduce plastics, trying to avoid lots of fragrance and harsh chemicals. These things all add up.
Right, because we have a pretty big bucket of bandwidth, I would say, as humans. Like we have a
Yeah,
pretty large capacity to tolerate a lot of things,
sure.
but if you're not letting your bucket drain, then the bucket overflows, and
Right.
that's when people get sick.
And the fix is not like adding more supplements to the bucket, right? You have to open up that drain. That's a thing. I think that every pill that we take has to be processed through our liver and kidney, consumes a little bit of oxygen. While I love supplements, in my office we have 2,000 different supplements from 100 companies. I think that they're fabulous. That's not the only answer and not the first answer for most people.
And that's not what you prescribe most of the time. You're like, how can we offload that
Right.
step so that
Yeah.
when you do take something, it actually is impactful?
Correct. Yeah. How can we do the least to get the most benefit? That's my philosophy.
Which is brilliant and why it works, right? Because like how to like doing the most is sometimes doing the least,
Yeah.
which is a bummer.
It's exhausting and it's not sustainable.
Yeah,
Yeah.
I've tried.
A lot of people
Yeah,
have.
it's hard because you're like, I know that I don't
Yeah.
feel well, so like I'm gonna throw everything at it
Right.
because I know that I don't feel good. So like, I might as well try 100 things because
Sure.
I don't feel well. So I might as
Mm.
well just
Yeah.
throw the kitchen sink at it.
Yeah, I get that.
Yeah,
When you don't feel good, you don't care. It's like you just want to feel better.
yeah.
Yeah, I get that.
Learn through osmosis. If you're feeling that way, work with someone like a Laurel who can help you figure out what the most effective and efficient version of getting you to optimal health is.
Yeah.
Is there anything that you'd like to add that we haven't chatted about?
No, just thank you so much for doing this. People don't know what they don't know. So I love that you're taking the time to interview people and people that you trust and that you've worked with and asking you are a fabulous interviewer. You ask all
Yeah.
the right questions. So I love that. So thank you.
Thanks so much. Please tell people how they can work with you.
Yeah, so I'm at the Cone Health Institute in Costa Mesa, right by the John Wayne Airport. It's a huge facility. We have 14 providers, 29 different healing modalities. It's a busy place and we have a wide variety of different providers. I'm obviously a naturopath. We have chiropractors, acupuncturists, massage therapy, um, what else?
Esthetician.
Oh, holistic esthetician, and then all these different healing modalities. Um, the office is now doing a once a month health class on Wednesday nights. So it's one Wednesday each month that you come in. It's a 2 hour Q&A session, and then the doctor does some demonstrations of some of the therapies that we offer. So that's a great way to get your foot in the door and learn a little bit more about what we do because there is some unique therapies. We talked about ozone, but that's one of many of the unique and really beneficial holistic therapies that we offer.
And what's the process to work with you? You just say, "Hi, I'd like to work with Dr. Laurel."
Yeah, so I mean, probably the best thing to do is to go on the website and you can read through my bio. I have a quick video in there and it talks about some of the things that I specialize in. And then it kind of just goes through the office a little bit more. But usually people will schedule a new patient consultation with me. That's an hour appointment where I go through all of your symptoms and health history and then we decide our course of action. People oftentimes come in already have seen other doctors. They'll come in with lab that they've already done or testing that they've already done. And we go through that and see, do we need to do more testing or maybe not? Maybe we just need to sift through that stuff and tweak a few things.
I forgot to ask you this, but now is the moment. What does it look like to work with you? How often do you normally see people? Like, what's the process timeline wise of
Sure.
working with you?
Yeah, I mean, my goal is always to graduate people out of my care, right? That's what I want to do. So usually that means that I'm going to see it's going to be more front loaded. I'm going to see you a little bit more in the beginning and then slowly transition away and be healed and learn all the things, right? Doctor means teacher. So we want to teach you how to better live your life and keep your health and your nutrition, all those things vital. But yeah, so again, it depends. Like I keep saying that, but I'll see you more in the beginning and slowly go down to maybe once a week for a little bit and then once a month and then once a quarter as you improve. And then I have patients that, still come and see me on a regular basis just because they like to, because they feel to keep their health optimal and because they feel better. But my goal is to get you out of the system as soon as possible.
Or just come see you once a year for yearly.
Yeah,
Like, let's run labs. I'll see you in a year. We'll see what you look like, and then we'll
right.
come up with a game plan.
Yes, for sure. That's a common thing as well.
Thank you so much for joining me. You've been listening to Authentically Shawna with Dr. Shawna Burke. The information contained in this podcast is provided for information purposes only and is not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before using any products or techniques referenced in this podcast, consult your healthcare provider. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. Thanks, and we'll see you next week.